Welcome, everyone. I welcome you to SIU and to your new next journey in life for residency orientation and fellowship orientation. I am Dr. Kariana Brenham. I am the Associate Dean for Graduate Medical Education and the Designated Institutional Officer here at SIU. And I have the great pleasure of getting to welcome you to SIU. One of the things that is going to be a lot of new information for you is really what residency is all about. And I'm sure you all have some ideas of what to expect, but I really wanted to go over just the general concepts of residency and what the ACGME or the is all about and what we are going to expect from you here when you join us at SIU. I have a couple different videos that I'm going to share with you today. And the first one is really going over an introduction to GME in general, competencies, and milestones. And I'm going to talk to you a little bit about your journey over the next several years and learning here at SIU. So to start, I'll talk to you a little bit about the Accreditation Council for Graduate Medical Education, or the ACGME. And you will hear lots about ACGME over the next several years, and essentially this is the governing body that accredits all of the residency programs and fellowship programs across the United States. And in particular, those programs here at SIU, what are some of the things that we have to make sure we're providing for you as residents and fellows, and what is so important about making sure you get the best education that's standard and consistent across the United States. When residency programs were initially started, there could be some variations in residency programs, and the ACGME was created to make sure that all residents get the same training, have the same requirements, and that residency programs and institutions are held to high standards to make sure you're getting that training. So I'm going to talk to you today about institutional common and specialty program requirements. And we're going to talk about, in particular, the clinical learning environment, maybe work hours, competencies, milestones. And so you're going to hear a lot about these different things. And essentially, these are the different areas that the ACGME has oversight for residency programs and institutions as a whole, like our institution here at SIU. So what are a little bit of history and a little historical knowledge about ACGME? So the biggest thing that is really important for ACGME is the core competencies. And the core competencies were created back in 2001. And really that's what helps standardize residency training across the country. The core competencies, as you see here on this slide, include patient care, medical knowledge, practice-based learning and improvement, interpersonal and communication skills, system-based practice, and professionalism. These will become a part of your everyday training over the next several years. These are the areas that all residents and fellows are assessed on an ongoing basis. These are the different areas that we expect you will receive training here at SIU in your residencies and your fellowships, and really that we expect for you to be competent in all of these issues by the time you complete your training with us. One of the next great milestones for ACGME were work hours. Back in 2003, there was a new set of work hour or duty hour laws or requirements that came out through ACGME. This was in response to concern about overwork of residents and residents being used for at times scut work and work that maybe really wasn't contributing as much to their education and really was just it could be exhausting, and even at times residents were working more than 24 to 30 hours in a row and were working many nights on end. And the fatigue really affected not only the patient care, but also the educational needs that residents had to be able to train to be the best physicians in their specialties that was needed. And so in 2003, duty hours or work hours came into effect, and these were governed and monitored by the ACGME. There was an emphasis in 2011 on supervision, healthcare quality, and patient safety, and those all followed up with the fact that duty hours were really kind of a focus on making sure residents had a safe environment, a good environment to learn and to provide the best patient care. So the follow-up in 2011 really emphasized that residents had appropriate supervision in the work they were doing, really focused on healthcare quality and patient safety. Again, all of those are things important for patient care, but also important for resident education. So in 2013 is when the ACGME rolled out the new accreditation system. Prior to this, we called it the next accreditation system, and just changed that letter and made it, or that word, and made it the new accreditation system in 2013. And this really gave the ACGME a chance to reset and really focus on all of the different requirements that would be needed across graduate medical education training. And so really focusing on the clinical learning environment. Other things that came into effect at this time were healthcare disparities and the educational milestones. And the milestones are going to be really important when we're talking about the expectations for residents as they advance through residency training. Prior to this, there was a lot more focus on numbers of patients seen or surgeries performed, and really looked at more the amount of experience than the quality of experience, and looked more at how much residents accomplished rather than were they becoming competent in areas. And this new accreditation system really focused on competency and meeting milestones as you go along in your training. In 2017, the ACGME looked at where we needed to make some focus and some adjustments in training for well-being for residents. Not only well-being for residents, but well-being for faculty as well, and everyone that is involved in residency or in medical care and in patient care. But from an ACGME standpoint, in graduate medical education, really focusing on the well-being of those that are providing the care, the residents and the faculty and program directors and others. In addition, as we moved along, equity and inclusion became very important in 2021, and there were some expectations from ACGME to look at the focus on providing equitable and inclusive care to all our patients, and that started with having good representation from our faculty, our residents, our staff, everyone, to make sure we were providing the best care to our patients in an equitable and inclusive environment. One of the most recent updates from ACGME was the parental medical or caregiver leave policy. This came out in 2022, so it's fairly new, and really has been a huge benefit to focus on the fact that residents are in that time of their life where many are expanding their families, or may just have children they're taking care of, parents they're taking care of, their own health concerns to address, whether it be medical or mental health issues. And the PCML, or the parental medical caregiver leave policy, really looked at giving an opportunity for residents to take leave to address these issues that may be from having new children, expanding families, or taking care of their own physical or mental health, and really giving the opportunity to take that time and that leave away from residency without being penalized and having to potentially extend residency training or not have vacation or sick leave time available. And so this came into policy in 2022 and has been a great benefit for residents and fellows alike. I would invite you to take a look at this website. This is the ACGME website, and it just gives you a picture of all of the wonderful activities going on for ACGME, the resources. I would invite you all to just, at least before you start or in the early parts of your career, to take a look at it. It's also divided up into specialties. So whatever your personal specialty is, you can look in those areas and take a look and see what the ACGME is looking at for your specialty, for residents in general. There are so many different educational resources here in their website, and you can take a look at it. There are resources for program directors, program coordinators, up for me as the designated institutional officer, and also for residents and fellows. And then, like I said, dividing up into those specialties. So I would invite you to take a look at this at some point in time, as before you start or shortly after. One of the big things that we're going to talk about is milestones. And if you look on the ACGME website, you'll see this area of milestones. And like I already hinted at, the new accreditation system really focused on milestones. And the best way to explain milestones is these are the goals and objectives we hope that all residents and fellows meet as they're progressing along in their training. So educational milestones are a roadmap for growth and development during training. It is a narrative description of competencies, subcompetencies, and it's on a developmental continuum. We don't expect all residents and fellows to come in being experts in their specialty, but we expect different milestones to be met along the different years of training. And so this is a framework of observable behaviors and other attributes that are associated with development of a physician in training. Think of something like the Denver Developmental for babies, for those of you that are peds, or the Bailey Developmental Scales. These are showing as an infant and a child would develop, they would meet different milestones along the way. Well, we expect the same for residents and fellows. We don't expect you to come out of medical school knowing everything, but we expect as you go along different milestones to be met. And so these are created for really for residents and fellows to look at patients, residents, fellows, faculty members, program leadership, accrediting and specialty organizations to really demonstrate that development and that progression for residents. The learning curve and developmental milestones, as you can see on the little graph here, start with more that novice level, goes to the advanced levels, competent level, proficient, the expert, and the expert is really that faculty or that physician that's been out in practice for a while. We don't even expect all residents to make it to that expert level by the time they graduate. That's something that is aspirational and something that you continue to gain knowledge and learning as you go along in your medical career. Medicine is a lifelong educational process. And so just because you graduate from residency or fellowship doesn't mean you're done learning. You will continue to learn your entire career. We told you that after medical school, and it continues to apply throughout residency and beyond. So you can see those, and medical school often come in at this novice. In medical school, they're novice. They're not allowed to practice on their own. You graduate, you're allowed to practice, but with full supervision at that advanced level. And then maybe with less supervision as the competent level. Proficient, you may even be practicing without supervision, and then advancing to supervising others. So kind of taking a look at this, we really look at the group mean. So this is just one of those number graphs and looking at 18 residents in a pediatric specialty, kind of where they were in different type of categories. And the group is really going along the projected curve. But if you look at individuals may progress in different ways. They may, and some milestones be really high and others less so. And there may be some individuals in a PGY1 class that are at one level and others at another level. But overall, those average out, and we expect that group to advance as they go along. This is a great example of a milestone for urgent and emergent medical conditions For the, and this is in patient care. So we talked about all those different competencies. So looking at patient care and looking at one of the sub-competencies, and that's urgent and emergent medical conditions. And this would be for a family medicine resident. And you can see at that level 1, which we often expect as a PGY1, so a first year in training, would be expected to meet milestones like recognizing urgent and emergent conditions. At a level 2, they may be performing initial assessments. This would maybe be in that PGY2 year. They would be able to discuss and clarify code status with families. In the PGY3 year, or in the level 3, they would be using the code status for clinical decision making and providing initial stabilization in patients with urgent needs. And then in level 4, and you can see that some residents may make this level, but maybe more of being out as a faculty, you're coordinating the initial assessment and management, considering families and coordination of care. And level 5 is that anticipation, the anticipating clinical decompensations, being ready for things. And this, of course, comes with time and experience. Assessing desired outcomes really is a growth-based learning process too. So work-based assessments is often accomplished through observations and questions. And this would be with team members, faculty, peers, co-workers, even the nursing staff and others that you work with. You can learn so much from others. The first is really looking at the knowledge and multiple questions. Knowing how and diagnostic reasoning or clinical vignettes can help. Showing how is watching and showing your clinical skills. Your faculty may be observing you do different medical procedures or seeing a patient, or maybe this is in surgery. And then the performance and practice is that do type of process. And so this kind of shows you that pyramid of progression as you go along. Educational milestones represent a shared model for how a resident and fellow can get to the next stage. So there are expectations in the milestones, and residents are aware of these expectations. The faculty and what we call our Clinical Competency Committee, or CCC, will look at all of the different processes for each individual resident, assess where they are on that progression of milestones, and then that will be communicated back to the resident, and they will understand where they are and where they're going. And the process is really representing that this is an ongoing training and an ongoing process of improvement throughout training. This assessment can be done by faculty through direct observation, and assessment through faculty and peers and patients and staff and others. Educational milestones are criterion based, and they really are supposed to be actual to the PGY level. Of course, we have PGY ones that are showing competencies at a PGY at a level 3, but really we're at least expecting people to make those level 1 at PGY1, level 2 at PGY2, and so on. And programs judge each resident or fellow based on the actual performance as described in the milestones, not in relation to peers or others. So it's not supposed to be, well, their peers are at this level and they're above or below, but really looking at those expectations and requirements. And this gives you that a milestone example for family medicine of the acutely ill patient. And really kind of you can see those different milestones progress too. So seeing those difference as they go along. Starting with the differential, then prioritizing differentials, developing management plans, implementing those management plans, and incorporating psychosocial factors as you go along, mobilizing multidisciplinary teams, and then efficiently managing and coordinating care with others too. So lots of steps in this advancement. Level 4 is the recommended graduation goal or proficiency. So we're expecting most of our family medicine residents to get to that level 4. And depending on the different residency programs, the different number of years, we're seeing that progress as you go along. Harmonized milestones are really, this is an example of a psychiatric milestone, and really looking at physician role in healthcare systems. And so we talked about all those different competencies. So we're also looking at things along the lines of professional and practice-based learning, and seeing how residents and fellows learn in a healthcare system and understand complex healthcare systems and advance in those areas. So it's not just patient care. We're really looking at all the competencies and how they progress in milestones evaluation. Milestone feedback to residents. And so this is what it would look like as a potential feedback to residents. So the report comes back to a resident that you are at a level 2 or level 3, and you should be able to look at where you were the prior year and see that that advancement is taking place. Milestones assessments per ACGME policies are expected twice a year. So they're a biannual process, and all residents should get feedback on those milestones twice a year so that you can see that you're advancing in each of these categories. The feedback to residents is often given by a one-on-one with either the program director or possibly a mentor within the program, and giving you that area and all those sub-competencies so you see where you are and where you're going. And you can actually look at the milestones and the expectations to advance to that next level. Individual milestones trends are often tracked, and you can see where you are going through in each academic year. And this is looked at for each of individual residency to make sure that progression is ongoing and that somebody isn't stalling out in a certain area where there may be a little more work in certain areas, some redirection that faculty and program directors may need to make with residents to make sure they're progressing. And being able to see this progression is really helpful in doing that and planning out possible personal educational plans for residents to continue to make those advancements. As I mentioned, every 6 months, programs must report milestones to ACGME and at the same time to residents and faculty as well, and fellows as well. The data is shared in aggregates only, so it is not that the ACGME is monitoring individual resident progression. They're really looking at an aggregate that programs are seeing their residents advance throughout. And milestone feedback to the program, you can see this is an example of a matrix for patient care subcompetency in family medicine. Really partners with the family and patient and community to look at where they are through that. And this is the way that the program can look to see that their residents are progressing through these different milestones. So that is a great, a quick little overview and summary of some of the ACGME requirements. Gives you a quick history of ACGME, and one of the biggest things that you will probably be most concerned about is the milestone progression. So hopefully this was a great, quick sneak peek into what you're about to journey into in the next several years. If you do have any questions or comments or anything else, I've provided my direct office number and my email. Feel free to reach out to me at any time before you start or during your training. I have an open door policy, and I hear from residents quite often with any questions or concerns as you go through residency. I'm always there for you. Of course, your program director is as well, but I'm also available as a resource to answer questions. So thanks for bearing with me today and watching this video and learning a little bit more about ACGME and what's going to be expected of you when you are in residency training. So thank you very much, and I look forward to seeing you in a few weeks in person. Best of luck with your travels and getting situated here in Springfield, and see you all soon.